If you have a phobia and are wondering whether EMDR therapy can help, this video is for you. What I'm going to cover is what are phobias, common symptoms, how phobias can be a result of trauma. I'll also give you a quick rundown of EMDR therapy, and I'm going to tell you in what cases EMDR therapy can be an effective treatment for phobia. And finally, I'm going to give you some reasons why you may want to choose EMDR therapy to treat your phobia. Hi there, my name is Ashley Phillips. I'm a practicing trauma therapist and the founder of the Kelowna EMDR Clinic. If you're new to the channel, welcome. Here I cover various topics including trauma, my experience in private practice, and EMDR therapy, which can be a very effective tool for treating phobias. If you haven't done so already, I encourage you to hit that subscribe button so you don't miss out on my future videos. Broadly, a phobia is classified as a type of anxiety disorder. It's an excessive and intense fear of certain objects like needles, animals like spiders or snakes, places like heights or enclosed spaces, or general situations like driving or flying. This fear can be overwhelming and it's often debilitating to a person's life, especially when the trigger is something they frequently encounter. For the person that's experiencing the phobia, the fear is very real. It's typically considered irrational because the fear is much more intense than the danger of the situation would actually justify. Often a person is going to have mental, physical, and behavioral symptoms. Mental symptoms include like an intense fear, feeling like you need to get away or escape, feeling like you're in danger, and feeling like you're disconnected from your body or the environment. Physical symptoms include shaking and trembling, an increased heart rate, dilated pupils, hot flashes or chills, feeling lightheaded, feeling dizzy, there's a tightness in your chest, hyperventilation, tunnel vision, and even fainting. Behavioral symptoms are typically around limiting or eliminating exposure to your phobia trigger. So for example, a person with a phobia of the dentist they're going to avoid going to the dentist, and a person with a fear of drowning may not go near any bodies of water. They may move away from or even avoid moving to a place that's close to a river, lake, or an ocean. And while not all phobias are linked to trauma, there's some definite situations when experiencing a major or even a minor traumatic event can lead to a person developing a phobia. There are three main mechanisms through which trauma can lead to a phobia. The first one is through direct exposure. An example of this would be a person who's involved in a car accident then develops a phobia of driving. The second mechanism is through vicarious exposure. This is where you don't have a negative experience directly, but you hear the experience from those close to you. So for example, I have a friend from the former Soviet bloc who had a phobia of dentists. And this phobia did not come from having a direct negative experience with a dentist, but rather from her parents sharing stories about their visits to the dentist for various procedures without any anesthetic. Like seriously, that was a thing. The third mechanism of how trauma can lead to a development of a phobia is through sensitization to a stimulus. So simply put, there's many instances of people from Ukraine, especially kids, who managed to escape the Russian onslaught, who have developed a phobia response to the sound of airplanes, helicopters, and fireworks. I feel it's important to emphasize that it's not just big T major traumas that can result in a phobia. Minor trauma can be sufficient. A negative experience at any point in a person's lifetime can be enough. For instance, a person can develop a phobia of needles as a result of painful vaccinations in childhood, or a phobia of hospitals because something bad happened there and they're going to avoid it at all costs, or a phobia of getting their blood work done because the smell of the cleaning agent in the lab was so powerful it actually made them faint. Now, if you have a phobia, I'm curious what strategies that you found to be helpful in managing it. Let me know in the comments below. Since this video is about EMDR therapy as treatment for phobias, let me quickly tell you a little bit about this therapy. EMDR stands for Eye Movement Desensitization and Reprocessing. It's a type of psychotherapy that was developed in the 1980s, and it's been widely researched and studied in the decades that followed, and it's shown to be very effective at treating various conditions that are caused by unresolved trauma. Here's an analogy I like to use with my clients. Much like the body heals from physical wounds, the brain often heals on its own from psychological wounds caused by trauma. But sometimes the mind gets stuck on a traumatic experience and it never really heals. This stuck trauma manifests itself into a variety of symptoms, and phobia is among them. EMDR therapy works by helping the brain process past traumatic memories in a way that reduces their emotional intensity. As the brain heals from past trauma, the symptoms related to the negative experience resolve themselves and cease being an issue. If you want to learn more about EMDR therapy, you'll find some useful links in the description below. One is a video that I made that provides an overview of this therapy. Another is a series of videos where I go into much greater detail describing the 8 phases of EMDR therapy. I really encourage you to check them out. Okay, so we've talked about how phobias can be caused by past trauma and how EMDR therapy works to resolve past trauma. So as long as your phobia is linked to a past traumatic experience, EMDR can be very effective at treating it. The best thing about EMDR, and the reason why I love it so much as a therapeutic modality, is that rather than treating the symptoms, EMDR targets root causes. So instead of people just managing their symptoms, EMDR can help get rid of the phobia for good. As I mentioned earlier in this video, EMDR therapy works by getting the traumatic event unstuck so that your brain can process it and resolve the past trauma. And as a result, your anxiety that was caused by the traumatic experience just melts away. And this happens because the underlying trauma doesn't have the same effect on you as it did before EMDR therapy. It's worth noting that if your therapy is not related to past trauma, EMDR therapy is not the most efficient approach. Exposure therapy and cognitive behavioral therapy are fantastic options. The best way to find out if EMDR therapy is the right approach, you need to talk to a therapist or a mental health professional who specializes in phobias about your specific situation. Lastly, I'd like to give you 5 reasons why I think EMDR therapy is one of the best treatment options for trauma-related phobias. Number 1, EMDR therapy typically treats phobias faster than other talk therapies, saving you time and money. I've seen this with my own eyes where clients have had phobias for many years who have tried other therapies and they've shown a noticeable improvement after just a few EMDR sessions. Reason number 2, EMDR therapy doesn't require you to recall and relive the traumatic event in great detail. Yes, we're going to revisit the memory during therapy, but we're not going to get into the nitty-gritty parts of it for the therapy to be effective. The benefit is that EMDR therapy can be a lot less triggering than other talk therapies. Reason number 3, EMDR therapy doesn't have a lot of homework associated with it. I generally ask my clients to practice emotional regulation strategies between sessions and to keep a journal of their symptoms so we can keep track of progress, but that's about it. Reason number 4, EMDR therapy is a prescription drug-free approach. Some people really don't want to use prescription medications to help with their phobia for various reasons, and EMDR therapy can be a really great tool that can help reduce their symptoms. Medication absolutely can be helpful to get the phobia symptoms under control, but it's not going to resolve it. And finally, reason number 5, EMDR therapy goes after the root of the problem as opposed to just treating the symptoms. Many therapies teach you strategies for managing your phobia, while EMDR therapy targets the cause of your phobia. I like to use the weeds in the lawn analogy. Most therapies aim to keep the weeds short and under control by mowing the lawn. EMDR therapy, on the other hand, removes the weeds with their roots. I hope you found this video helpful, and since you've made it this far, why don't you give this video a like because it will help others find this information. And if you haven't done so already, make sure to subscribe to my channel so you don't miss out on future videos. See you next time.